Hello, everyone, and welcome to BizTalk, presented by the South Windsor Chamber of Commerce. Today's episode is sponsored by Crystal Financial Insurance Services, providing insurance and educational services to individuals, families, and businesses across Connecticut. To learn more, check out www.crystalfinancialinsurance.com. Hosting today's episode from the South Windsor Chamber of Commerce, I'm Vasant with James Babcock. Today, our guest is Heather Oatis, who is our Environmental Health Officer at the town of South Windsor and who runs the health department. Welcome, Heather.
Thank you for having me.
So just to jump in here, Heather, can you tell the listeners and viewers a little bit about your professional background and what brought you to the town of South Windsor?
So I have been working in local health departments for 15 years already, which feels shocking to actually say out loud. I started my professional career down on the shore, working for a health department as an administrative assistant. And I got myself credentialed and certified to be a health inspector in food and septic inspections. And then when the opportunity presented itself, I got a promotion there. And from there, I moved up to working for the town of Manchester for several years. And now I've been here in South Windsor for 7 years. I think South Windsor is a great fit for me professionally. I love environmental health and I'm doing what I can to keep the residents as safe and healthy as possible. I'm just about to finish my graduate degree in public health, so I will shortly be the director of health for the town and continue my functions on inspections and different administrative things that I do for the town.
Awesome. So you definitely, you're a very important person in our town, huh?
Yes.
Awesome. So one of the questions that always comes up, right, is that, a lot of towns have health departments. And I think as a physician, I've interacted a little bit more with health departments, but a lot of people don't know what our health department actually does. And I know there's probably a lot that you do that we don't know about. So kind of give us an overview, and our listeners and viewers, what does, someone who runs a health department, what do they do?
No 2 days are ever the same, which is one of the top reasons that I really honestly can say I enjoy my job. Some of the essential functions that we do that we're required to do by state statutes are to do food service inspections at different restaurants, and that also includes public schools and churches and gas stations and private clubs like the Freemasons and Elks and things like that. We also inspect temporary events and food trucks to make sure that the public is getting access to safe and healthy food when they're at these public events. In addition to that, we regulate septic systems in town. So there's a decent portion of town that isn't sewered. So we do plan reviews and inspections and final inspections as part of repairs and new construction. We also oversee well drilling in town, and we approve well locations and review potability reports. We do annual inspections of all daycare establishments in town. We also annually inspect all public pools at condominiums and hotels. It's coming, not here yet. So those are some of the basic functions that we do. I'm also the town's noise control officer, so I enforce the noise control ordinance. We also get a lot of complaints, which I'm sure is hard to believe, but we routinely go out for noise complaints, housing, garbage, all sorts of random things that you wouldn't even think of. I also submit ticks to the State Agriculture Experiment Station for testing for Lyme disease and other parasitic diseases. I think those are all, and cosmetology establishments. We also annually inspect all of the cosmetology establishments for hair and nails and other tattooing and things like that. I think that's just about the full gamut of what we do on a daily basis.
So I think the next thing we're going to have to learn is how do we clone you? Besides developing this COVID vaccine, is how do we clone Heather Oatis?
That would be great. That's my full support.
It sounds like you got
it's fascinating. So go ahead, Gene.
No, well, I was just going to say, go ahead, Vasant, because I was going to jump to a different topic.
So how do you think people, so you mentioned a bunch of things, right, that you do. So for the general public, how do they interact with you? Would they go to you to ask questions? I mean, I know some of these things are like approval related and things like that they're going to have to get approval for. But how does, you mentioned ticks. We talked about bats a little bit before. So how does the general public actually interact with you, and what resource do you provide for them?
So you can go to our website, and it's southwindsor-ct.gov. And you can go to the health department page from there. And that's where we have a bunch of information on the services that we offer. And from there, there's a direct link to click to email me. People can always give me a call. Right now, our building is closed to the public, due to COVID. But email and phone are always available on the website, and my phone is always with me. So I'm usually not too hard to track down if someone has a specific question. And people call me and they always say, "Oh, I'm so sorry to bother you," but it's like, well, that's why I'm here. I'm happy to help. It's my job to answer, especially things like septic systems and wells. They're really not complicated, but if people don't have exposure to them, it can be really intimidating and can, make or break a house sale, for example. So, I always encourage people to call me to talk things through, because often, misinformation or just a lack of information can make such a big difference for people. And I'm happy to be that resource for people.
That's great. I mean, it sounds like South Windsor has a great resource in Heather. So
thank you. And Melissa, she also works here and she's amazing. Just saying.
So what is South Windsor doing as part of COVID vaccination efforts?
So a long time ago, this state set up what's called mass dispensing areas, MDA, and we were partnered with the town of Windsor. So that way, when things like this happen, we can pool our resources, both financial and physical resources, to have a combined effort, and staff too, for that matter, to vaccinate the public. So ever since last year, I've been working very closely with the town of Windsor. Obviously, there's been years of planning and preparation for this in advance, but now we're actually putting the boots on the ground. And so with the town of Windsor, we're holding 2 routine vaccination clinics, one in Windsor on Tuesdays and one in South Windsor on Thursdays. And those clinic appointments are available through VAMS. And so we are, turning the lights on, putting up the cones, getting people registered and getting people through the line. We're doing about 100 to 200 first doses a week. And then we're also doing the complimentary second compliments, the right word, second doses for those people 28 days out, because we're offering the Moderna vaccine. So people are coming. We've had a lot of success. People are reporting that they're enjoying the clinics and that they think that they're well run, which we appreciate. They're both at town buildings, so people do have to come inside, but we've got social distancing markers up. Everybody's wearing PPE. And they have to stay for 15 minutes after their vaccine for observation, and they're sent on their way. So we've been very, very busy. I don't know off the top of my head how many we've done, but figure we're about 8 or 9 weeks into this now, and a couple hundred a week over 9 weeks. We've got to be getting close to at least 1,000 first doses by now.
That's fantastic. I think obviously this has been a big week, and I think we used our foreshadowing to schedule this talk at a very opportune time.
Mm-hmm.
So obviously the state has pivoted in terms of the vaccine rollout and sort of the plans. Right now it's going to be completely age-based. There's a lot of confusion, I think, with the general public as to how they go about registering for a vaccine, right? And so we see advertisements, that there's large hospital systems that you can actually register through their portals, which is separate from VAMS, and then that's still separate from the pharmacies. So it's almost like people can go shopping in different systems to figure out where they can get their vaccine. So could you just sort of, from your perspective, shed light as to what are the different ways people can get their COVID vaccine, and how do they go about choosing? And just kind of walk us through that process, if you don't mind.
That's a very large question, so I will do my best. The most important thing, and I think to date has been the biggest struggle, as the age brackets have been the primary reason people are getting vaccinated, is internet access and computer access. That's really been a very big hurdle for people. So the big thing is to get online, and people can take themselves to, if you literally just Google CDC VAMS, VAMS, Vaccine Access Management System, you can just go there and get logged in. It is age-based right now. So if for whatever reason you have internet connectivity issues or computer issues, or just are generally not a fan of the computer, which is also very real for a lot of people, they can call our Human Services Department. Their phone number is 860-648-6361. And there is human services staff who are assisting people in getting themselves registered. And that's going to be through the VAMS system, which will give you access to the South Windsor and Windsor clinics, as well as any other clinic in the state that's using the VAMS system. If you want to use the patient portals for Hartford Healthcare, UConn, and Yale, you can call them directly to register or go to their websites to register. I'm not as familiar with those because obviously we're not using them. The challenge comes when someone shows up at one of our clinics thinking that they, have an appointment, and they're like, oh, I have an account. I've already registered. If we have like an extra dose or something for the day and we've called them in, they say, oh yeah, I have an account. We don't have access to anything other than VAMS. So it can be challenging. And oftentimes, when you finally get your account and you get to register for an actual appointment, you have to look like several weeks out to get to an appointment, which can be very challenging because obviously everyone wants it yesterday. And the other challenge is once you have an appointment, you can't see other open appointments without canceling yours. So it's important to look broad and wide and not just keep yourself to the 10 or 20 mile radius sometimes that auto populates when you're searching. And to just be patient and understand that everybody will eventually get their vaccine in due time. Although I'm sure no one feels that they're getting it quick enough. We're getting them out as quickly as we're getting them. So keeping an eye on the VAMS system and getting yourself in at the appropriate time is important. But if you call other agencies, just be aware that it might get a little complicated going between Pfizer and Moderna and 21 days and 28 days and all that. So picking the one that your trusted source, whether you're already a Hartford Healthcare patient or a UConn or Yale, and if that's your path, just stick to it and own it and see that through. It will come to fruition. Or if you're not currently affiliated with them, going through VAMS when it's your time, same thing. We'll get you in.
And can we touch a little bit on, so in the pharmacies now, they've got selected sites, and you would actually go to the pharmacy website and you would register. Does that sound right to you?
It does. I don't know much about it, but that's what when I call CVS to refill a prescription, that's what it sounds like they're pushing you to. I know I've seen here in South Windsor, they've got the box out in the parking lot. I haven't seen anyone come in or out of it yet. I'm not sure if they're using it, but I'm sure calling the store directly would get you more information.
Got it. So just to recap for our listeners then, so it sounds like, so we've got 3 different ways potentially right now of getting your COVID vaccine. So you've got one method, which is a VAMS, which is probably the more widespread method, which all the town departments and such you log into. You would go there, you create your account, you schedule your appointment. You can only schedule the first appointment, correct? So you can't plan for your second vaccine. So there's a lot of questions that people have been getting. What if I want to travel? What if I want to do this? So you can't book 28 or 21 days later too. You can only book one at a time. Is that correct?
Yeah.
So that's one option. Then you've got the Hartford Healthcare, UConn, and Yale. So you would use, if you're a patient of that system, or actually you can create an account if you're not a patient of that system and book through there. And then your third option right now is using the pharmacies. And I believe the community health centers are also part of that VAMP system, correct?
To the best of my knowledge, but
Yeah,
I haven't had
so.
exposure to them yet.
Okay, great. So for the general public, these are your different methods. And as far as I know to date, it sounds like private practice docs and such are not getting the vaccine yet. It's with these large entities in sort of this systematic rolled out fashion. So thank you very much. That was very helpful.
Good.
So is there anything else, when we talk about the health department, anything else that people should know about what the health department does?
I think the most important thing for people to remember is that we're here to help you. And if you have a problem or a complaint or an issue, you can call. It's fine. Just because you've called us doesn't mean we're going to get someone in trouble. And I think it's challenging because people see us, we are a government agency, obviously, but our main goal at the end of the day is to keep people healthy and to keep people safe. And sometimes that makes for a hard conversation for us to have with somebody, or, with a neighbor with an issue like horse manure, or, something, totally bizarre that people feel awkward about calling us for. And it's important to remember that's what we're here for. You can call, you can ask questions. Asking questions are going to get anyone in trouble. And I feel like that's the biggest hurdle to people with calling us, is we're here to help. We're here to make as many people as happy and healthy and safe as we can. And we're happy to do that. It's never a hassle. And we're a resource. I know a lot about drinking water. I know a lot about septic systems and, daycares and all these things. And the public isn't expected to know all this information. It's impossible. And that's what we're here for. So never hesitate to call. No question is too silly. And I'm happy to, answer the same thing for whoever needs to hear it. So just give a call. We're here for you. Lab services, ticks, rabies, all these things. It's what we're here for. And we're happy to provide that service.
Awesome. Very good. Well, thank you so much, Heather, for joining us today.
Anytime. Happy to be here.
And to our viewers and listeners, thank you for joining on today's episode of BizTalk, once again sponsored by Crystal Financial Insurance Services and hosted by the South Windsor Chamber of Commerce. Have a great day. And to make an appointment with Crystal Financial, you can call the office at 860-436-9522 or check out their website at www.crystalfinancialinsurance.com. Have a wonderful day.